I'd like to thank the Pediatric Institute and Kementerian Kesihatan for actually inviting MPA to be involved in this. It's an issue, but I think you all know that the pneumococcal vaccine was introduced in the United States in the year 2000. And without knowing any better, actually in 2001, I actually wrote the ACIP guidelines in Berita MPA, which is the MPA newsletter, and wrote about the pneumococcal vaccine in the newsletter. That was in 2001. The vaccine came to our shores in 2005 October, and in 2006 this is how the journey began for MPA, and that's Sheila Majid. If you know, I knew her when I was a teenager, and there was a time I saw her after that. And with that first thing that we did in 2006, we then went on to actually go around the country preaching to pediatricians on train the trainer about the pneumococcal disease and the pneumococcal vaccine. And that was how it all began. And then, of course, there were TV interviews and then newspapers. And we actually did this advertisement under MPA. And we were heavily criticized by the committee because it was fear-mongering. We put a child, a picture of a child in a wheelchair and all that, so that was fear-mongering. So we changed it after that, and this is how it became later. And so this was all in the year 2006, 2007. And then Wyeth, which was the precursor to Pfizer, then came up with their own posters and advertisements as such. We then formed, in 2007, we formed this group called the Asian Strategic Alliance for Pneumococcal Disease Prevention with a group of other Asian pediatricians, pediatric infectious disease, epidemiologists, and they came from countries alphabetically from Brunei to Thailand, and then geographically from India and Pakistan in the west, and then to China and Korea in the east. And so, from there, we came up with a publication that was published in Vaccine, and this was an overview of the disease burden of invasive pneumococcal disease in Asia, and this was in 2009. Now, at the same time, there was numerous newspaper articles and publications and all that on pneumococcal in 3 different languages, trying to reach the public and tell them that this is available, about the disease basically. And then we tell them that the vaccine was available, but we don't push the vaccine because we were afraid to offend the Ministry of Health, which did not have the vaccine in the NIP. And then the program called Positive Parenting that goes to parents, and we have special issues, understanding pneumococcal disease, so that we publish. And at that time, almost every other issue had on pneumonia, on meningitis, on pneumococcal otitis media and so on, just to prime people. We've already primed the pediatricians, we primed the public then, and the activities of ASAP, or the Asian Strategic Alliance for Pneumococcal Disease, didn't just stay in Malaysia. The Thais did the same thing around the same time, the Filipinos did the same thing, and so did the people in Pakistan, Hong Kong, and so on. The program called Immunize for Life, this is an advertisement, all right? Immunize for Life is a program that is done by the Malaysian Pediatric Association with the Ministry of Health and the Malaysian Society for Infectious Disease and Chemotherapy. It was launched in June of 2013. And in the website, we have actually a video of what is pneumococcal disease. And you can watch the video if you go to www.ifl.my. Okay, if you feel like it, you have nothing to do tonight, you can just go to the site and then see what is there, and also there's a lot of other things there with regards to vaccines, and we've done it in both English and Malay, and we find that the views for the Malay videos are 3 times more than the English videos. So there's this vacuum of information that we actually need to fill. And then there's this program called Yes to PCV that was started by this lady here, Chan Lee Jin. She is an ex-writer, because she came for the first launch and the first press briefing that we did on pneumococcal disease. A year later, she came and we did the same thing. And then she was wondering, how come they keep saying the same thing, and then we're still not seeing the vaccine in the NIP? Then she started this, and she said, let's try and do this. And then she got funding and all that. So we had this signature campaign that went across, and we got 20,000 signatures that was all sent to the minister. The ex-minister, sorry. Okay, the ex-minister. Now, who was accompanying that? You know, he's a pediatrician, right? He's here. And this chap, his granddaughter died of pneumococcal meningitis. This lady's son died of pneumococcal infection. And this was another, these are people, this from, let's summarize here. Okay, all right, so, and you know, this is all the journey that we've been through. And just to show you what I mentioned just now, this is the annual pneumococcal PCV units that's distributed through the private and the government hospitals. If you look at from 2014 to 2018, this is the private, which is clinics and hospitals, and these are the government, right? They're small, but then you can see it is doubling. It went up to 666 at the end of 2018. And this is the estimated number of, I've told you earlier about the estimated number of patients that would have benefited from it, but using a 2+1 schedule. So the 2+1 is not what we do, as I said, so the number is probably less than this. So, you know, we're glad that we're having this meeting. We have left our footprints there, and hopefully the journey will continue until we can get the PCV available for every child in this country. So thank you very much for coming, and I'm not going to summarize what was spoken today because it's so complicated. I have to digest what was discussed today. And thank you very much for coming, and have a safe trip from wherever you came from. Thank you, and thanks from South Africa.